Today on the Leukopak Lady, I will talk about differences in donor cell makeup and why not accounting for these differences leads to inconsistency between leukopaks. So why does it even matter if donors are different from each other or if leukopaks are different from each other? First of all, consistency in starting materials creates consistency in manufacturing and patient response. Not accounting for donor differences guarantees inconsistent leukopaks. Differences in the collected leukopaks, like RBC, platelet, and granulocyte contamination, can wreak havoc on manufacturing method standardization. These contaminating factors can also create poor performing therapies overall. And we'll talk more about this on Friday. Differences in donor white blood cell counts, percentage of PBMC target cells, and donor size can also create inconsistent products if they're not accounted for. So I'm going to show you a table that I made as part of a recent editorial that I wrote on this subject. This table highlights differences in donor cell makeup. These are our hypothetical donors, but I feel they represent the donor diversity in this area that I experienced when I led a Leukopak collection program. As you can see, each donor's unique combination of white blood cell concentration, percentage of PBMC target cells, and total blood volume lead to different numbers of cells obtained if the collection is processed to either 2 times the donor's blood volume or if 12 liters of the donor's blood is processed through the instrument. I chose these examples because these are somewhat standard collection practices among different Leukopak suppliers across the country. This practice is carryover from patient collections or healthy donor collections for direct patient treatment, where as many cells as possible were collected. Healthy donor collections for allogeneic therapy use were begun using these same collection principles to collect to some kind of volume target. So as you can see, if a developer needs 10 billion cells to initiate their manufacturing processes, some of these donors would fall short of that target using one or both of these collection approaches. On the other hand, significantly more than 10 billion cells are collected from some of the donors. So imagine receiving one Leukopak with 18 billion cells one week, and the next week there's only 7 billion cells in there. You would feel cheated, first of all, and that second Leukopak might not meet your needs. So on the next episode, I'm going to continue this train of thought and show you the other half of that table and discuss how you can target 10 billion PBMCs to meet your developer's goals.